So this meeting was duly noted and posted. I'd like to, I don't know whether we approved the minutes of the last meeting or not, since it was an emergency meeting. Is there anything to approve for those?
I provided you a set of draft minutes for the 12/28 meeting earlier today. And I believe earlier you had been forwarded the last month's regular meeting minutes.
So we should vote on that then, I guess, those 2 minutes. So do I have a motion to accept the minutes?
I move that we accept the minutes from November 9, 2021 and December 23rd.
It was 23rd.
2020.
You wrote 28th on the
Yeah,
what you sent us. I believe it's 23rd.
I apologize. It was 12/23.
Yeah.
That's correct.
We'll make that change if you get that far. Remember, as a remote meeting, all votes have to be done by roll call.
Right.
okay. I second that motion.
Okay, so all in favor? Dee,
Aye.
Sheila,
Aye.
and myself, it's aye. So we accept the minutes of the meeting.
Both sets.
Both sets.
Perfect.
With the correction of the date
Yeah.
on the second one. Okay.
Yeah.
All right, so I guess we turn it over to you to run this.
As I believe the next agenda item is the alleged violation for City Smoke Shop. I believe we have Joyce Redford here for tobacco control. I think she has a colleague, is that DJ Wilson. And the City Smoke Shop is represented by attorney David Madoff. And I believe the owner is Mr. Patel. So I'll turn it over to you to, not sure, Joyce, if you normally go first or.
I would normally go first if it was like to tell you about the inspection, but I'm not, this is their appeal and I don't know what they're appealing, so that I can't answer the board's questions until I hear what the appeal is specifically.
Okay. So should we have Mr. Patel or Mr. Madoff?
Correct.
Sure, happy to do that. First of all, the basis for the appeal was set out in our December 10th letter to the town. It sounds like you didn't get a copy, ma'am. So let me go over it. Basically, we received a notice on about December 6th alleging a violation on November 19th of 2021. The notice says that the act constituting the violation was flavored vapable products. So we take from that the violation asserts a violation of 105 CMR 665.010D, which prohibits the sale of flavored tobacco product. We had nothing else to go on, but I think that's what it was. The violation asserts that that City Smoke wrongfully sold something called Delta 8. But Delta 8 is neither a tobacco product nor flavored. Tobacco product is defined in section 665 as a product containing, made or derived from tobacco or nicotine. Delta 88 is made from hemp. It is not a tobacco product. It's not a nicotine product. Also, flavored product is defined as a tobacco product or component part thereof that contains a constituent that has or produces a characterizing flavor, which Delta 8 does not. It is a strain of hemp. It contains no flavor producing constituents or add-ins. We've been aware of the issue and so received letters from the Delta 8 suppliers that City Smoke uses, indicating that the product does not meet the definition of a flavored tobacco product. I'm going to let Mr. Patel take it from here, but that's basically the substance of the violation. And he's going to talk for a moment about what happened and a little bit of background, if you could.
Yes. How you doing, guys? My name is Nilesh Patel. I am the owner of City Smoke Shop at 136 Andover Street, Danvers. So Joyce, as I've always worked with her in the previous times of all our locations. Um, so upon inspection, I was notified that uh, after she did the inspection in the space, she had told me that I'm not permitted to sell Delta 8 products. And if it, and once I was notified, I immediately removed the products as notified because she had come with the police officer as well as her. And usually I don't just make I don't make a problem over anything she says. And Joyce, if I'm wrong, please let me know. But usually, if you tell something to me, I remove the product immediately, hoping that I'm not falling into any negative compliance. I don't want to make any mistakes. Obviously, the rules have been changing seems like every day nowadays. But I feel like I'm doing my part in making sure that all the products that I have on the shelf have compliance letters through manufacturers, making sure that I don't fall into any flavored category laws um, in any perspective in the tobacco products that I carry. I wanted to make sure. So upon her inspection, I made sure that when she told me that the product wasn't permitted in the establishment upon mass.gov, I immediately removed the products. But I did notify her with all the compliance letter that stated that the products were not a flavored nicotine or tobacco related product, and they were not flavored products at all. They were actually hemp strains or cannabinoid strains that are under the manufacturing letter, which I provided under the 0.3% THCO, which is permitted with the natural flavoring, natural strain manufactured by the manufacturing letters. Again, I'm not the manufacturer, so I'm not, I can't say what's right and what's wrong. And I again, I'm learning as we go as well. But I know the product that we have, any product that we sell in our shop, after the flavor laws that came out and the tobacco laws that came out recent, with all the massive changes, everything is in a binder that was provided to the inspector or any inspector that comes in, notifying that all the products that we carry are on the shelf that have a compliance letter with it. So I was kind of a little bit of confused in that perspective. Why am I being penalized for a non-nicotine flavored product, or a product that was not the product that I had a compliance letter already for, and confirmed by the manufacturer that I did not carry any product otherwise. Upon her request, I removed the product anyways, because I'm not the type of person to go against the inspector, because obviously you guys do your research and you guys know better than me, and we're just a retailer and I'm not a manufacturer, and I don't want to be in any bad relationship or bad state with anyone. So I removed the product immediately upon her request, and upon the Danvers inspector that called me the following day, and upon the inspector, the police officer that came to inspect, to make sure that the product is removed. So the product immediately was removed, and I was not aware that I fell into a fine under the tobacco law, when it's nothing to do with tobacco. And I had manufacturing letters, and I never was notified by the police, by the state or the city, in regards to whether I can carry Delta 8. And I don't think any retailer in Massachusetts received any notification about Delta 8, not from the state, not from the city. But regardless, I did my part and I removed it upon the request of the inspector. So I'm just kind of a little upset that I was fined for something that that wasn't completely notified, um, that I was falling into in the wrong state. So I'm just trying to understand, uh, can I get a warning on the product, because I did not I did not fully, and obviously Joyce understands, I did constantly email her to understand where I went wrong, and I'm trying to improve myself every day as a retailer because of all the new rules and regulations, and I don't want to be in any negative place with anyone or anybody with the new rules and regulations that are coming in. So I'm just trying to understand where I went wrong, and can I get a warning rather than a suspension for a mistake that that I may or may not have made under the law's eyes.
So this is where I'll come in for the board. Just a little background for the members, and then I'll let DJ speak to this specific product and the nicotine part of the appeal. So first and foremost, for a little history, just in terms of the flavor restrictions in the state of Mass and the products, we have a history that dates back to September of 2019. And this is when the governor enacted a ban on all flavored vape because of the EVALI incidences that were happening around the state and around the country. So on September 19th, 2019, the governor banned the sale of flavored tobacco and marijuana, anything that was vapable. That was in place until January 25th, when the legislature enacted the flavor ban that is currently in place. And he kept the effective immediately on January 25th, 2020, the flavored part of the regulation, or the state law and the DPH regulation, was continued. So no flavored products then January 25th. Then in addition, the state law went into effect, including everything else, like all the cigarettes and the cigarillos and all of that. But this ban has been in place with the flavored vapable products since September 24th, 2019. We did our due diligence. We sent out letters reminding the merchants, and when Mr. Patel says they didn't receive anything on the Delta 8 products, unfortunately, it's not the practice, nor is it the policy that they get notified about every item that they may or may not carry in their establishment. It's the retailers, and this even would include food products. Like if a retailer brought in some kind of food product that they weren't supposed to have, it's not the industry. I mean, it's not the burden of the Board of Health or the state or anyone to send these things out. You have to know what you're selling, whether it meets the guidelines of state, local laws, etc. And then to give you a little background on City Smoke in Danvers, back when on April 1st of 2020, we received a complaint prior to, but I did an inspection as a typical follow-up to go confirm or find out that it wasn't in fact really happening, was that we were informed that City Smoke was operating after the governor's emergency ban on non-essential establishments because of COVID. We went to his establishment and the windows were all blacked out. This is only 2 weeks after the governor, told all non-essential businesses they had to close their doors. Mr. Patel was in fact operating. He had blacked out all the windows and said on the window, curbside pickup. He should have been, and he was informed of the cease and desist, as we had sent out to all adult-only establishments, that they were non-essential. He made the decision that he was essential by bringing in soda, M&M's, Skittles, none of those items which anyone would believe was essential. And he was operating, at least then, his argument was that he was operating as a convenience store, which his permit didn't allow. So he did close, and he had an attorney back and forth with myself and at the time your health director, Mark Carleo, to which I did respond and Mark did respond. And I believe Alicia, I think I'm pronouncing your name incorrectly, you were aware of some of the correspondence back and forth at that time, and that was in April of 2020. No fines were levied on Mr. Patel at that time, but certainly could have been. He was open at a time when he shouldn't have been. He was selling products that he wasn't authorized to sell. He had flavored products in the establishment in April of 2020, and they should have been out as far back as September of 2019. So there was never a fine issued for that violation, but certainly he was made aware, and he did comply after that with the order. Opened back up once the non-essential ban was lifted, and then, as the town should have on record, we went out and did an inspection on July, let me just double check my dates. I believe it was July 15th. And what was found in his establishment at that time were flavored tobacco products. They were blunt wraps, which are banned locally, cigarillos, which were flavored, CBD, which was vapable, also a hemp product, and flavored tobacco or nicotine products in the establishment. And this was in July of 2020. So now going back again to the original September 24th, 2019, this is nearly a year later, and it was 2 months after, even if you would have thought that this all didn't apply to you until state law came into effect June 1st, this was 2 months after that, or 1 month after that. We also sent out a notification to all retailers, all permitted establishments within our catchment area, which is, as you may or may not know, it's 16 municipalities, with a visual training tool that said what was and wasn't going to be allowed. We, depicted Newport cigarettes, flavored cigarillos, flavored vape products, specifically showed some Juul products and things like that. So again, we sent out a mailing in April, we sent out a mailing in May of 2020 in preparation for the state law, but in terms of the flavored vape product, that goes back to September of 2019. He was fined for that as a first offense. That was a $1,000 fine, and it was paid. So I know that he agreed that this happened and that he paid the fine. And then when we were there on November 14th, that was when one of my inspectors went in and either spoke with Mr. Patel or whoever was working there and said, not 100% sure if this is a violation, but they found that Delta 8 products, they were flavored, and she informed him that, this might be a problem. He should have then taken advantage of that information and done his own due diligence. I went back with Sergeant, I always mess up his name. Baldassare. And we conducted the inspection and found the products that we're talking about, this Delta 8 product. And I believe that I sent to the board or through the health department, I sent a letter specifically indicating what Delta 8 is considered a controlled substance. It doesn't qualify as part of the Farm Bill for hemp because it's a synthetic. So once you manipulate it, the content of THC changes, and therefore it's not a legal product. This is where I'll let DJ speak to the state law and why it does go beyond tobacco and nicotine. And even just to acknowledge that on the July violation, we even listed on the violation that there was CBD was part of the violation even then. So he was aware that CBD, which is also a hemp product, flavored, was something that he couldn't have in his establishment. So I'll turn the mic over to DJ if the board doesn't mind, or someone doesn't have questions at this point.
Okay.
Hi, I'm DJ Wilson. I'm the Tobacco Control Director at Mass Municipal Association. And so I'm just going to go through quickly. We're in the state regulation that we believe that these products are included in the regulation and not exempted. So the flavored tobacco product definition starts out with means tobacco product. So then when you look at the tobacco product definition, the first 4 lines talk about more conventional products that have tobacco or nicotine, cigars, chew, that kind of thing. And then it goes into and says electronic cigarettes, electronic cigars, electronic pipes, electronic nicotine delivery systems, or any other similar products that rely on vaporization or aerosolization, regardless of nicotine content in the product. So, for good or bad, the state legislature approved the state law, and they included in that broad term, they included vitamin B12 that could be vaped, CBD, hemp. It's anything that can be that can be vaped is now under our jurisdiction if it's flavored. So going back to the flavored tobacco product definition, it does say in there that has a characterizing flavor. Characterizing flavor, it's a wonky term and a wonky definition, but it has been, this was first passed by the city of Providence as a city ordinance, and it went up to the federal court and they were sued. And the federal court sided with the city of Providence with this definition. We're in the same federal court district, so it applies to Massachusetts as well. So a characterizing flavor can be any flavor, and sometimes it can be tricky. Sometimes it could be a grape cigar. It says grape on it. Then the manufacturers got smart and took the word grape off, and so but it's still a purple wrapper. So we figured out that the purple wrapper meant grape. And so then we have a lot of different names out there. Unicorn vomit is a name. We don't know what that is as non-smokers or non-vapors, but teenagers all know what that means. So we've had to do a lot of whack-a-mole to try to figure out what is a flavored product and what isn't. And one of the ways that helps us is the manufacturer's letter. I will say that it's interesting that the company actually gave you a manufacturer's letter if they don't think they're a tobacco product. They must have thought they were a tobacco product, otherwise why would they do this? So that is one thing to keep in mind.
That was, sorry about the cut.
Go ahead.
No, that was requested upon the inspection by Joyce, that if you have manufacturing letters, give me the manufacturing letters, in which I reached out to the companies and said, hey, these are the issues. Can you please provide a manufacturing letter stating that these products do not have flavors in their natural strain product? Yep.
So they may themselves still believe they're not under this regulation, but in fact they are. And so their flavored versions of any product that they sell is covered by the state law and the state regulation. Any questions?
I have one. Technically speaking, everything is flavored. I mean, there's a flavor to everything. So what is the zero baseline that we accept above which you can't go?
Because that Providence ordinance made sure that they didn't put in a specific number, because otherwise the company would just be right at that number, which is where we find the difference between CBD and marijuana in terms of THC, right? There's a number and they try to stay right below it. So characterizing flavor, just, it means a distinguishable taste or aroma, and that is imparted, and it doesn't include a use of an additive or a flavoring that does not contribute to that distinctive flavor or aroma. And so it is true that a lot of our inspectors have to stand there and figure out what to do. A lot of our inspectors buy a product and open it there. But, eventually we all kind of know statewide what is and what isn't, because, there's a whole network of Joyces throughout the Commonwealth that do this kind of thing.
Can I just, this is Dave Madoff. Can I just make a point? I don't know if I'm on the screen or not, but so Mr. Wilson, I appreciate, your interpretation, but you used words like, in determining what is or isn't flavored, what is or isn't tobacco, you know, you said it can be wonky, it can be tricky, it's like a whack-a-mole. So you're asking to close down Mr. Patel for a whole week, for him to lose a whole week worth of business when, you know, when he's expected to determine whether something, you know, that's wonky, tricky, a whack-a-mole, whether it works. And what he did was the only, and Joyce, you know, you mentioned as well that you can't regulate or you can't give a definition of every product and whether it is or isn't. So he goes to the manufacturer and gets a manufacturer letter saying it's not, you know, what it's not a flavored tobacco product. What else is he to do? I mean, if he's wrong because you guys have determined that the Delta 8 product is a flavored product, okay. So when you told him that, he took it right off the shelf. But to shut him down for 7 days on that sort of analysis is just, you know, it's just not right.
It does come down to the characterizing flavor definition, regardless of the words I've been using, but that's what it does come down to. And there have been a couple of cases where we across the state have had a product that is on the list as a non-flavored product. Our inspector has brought it back to that particular Board of Health, and they do actually a sniff test before the Board of Health. And in one case, I believe it was the town of Barnstable or Yarmouth. It went to court, and you know, the court determined that the Board of Health had normal sensibilities in figuring out what is flavored and what isn't, and their determination was correct.
I will also just add that these, first and foremost, Delta 8 shouldn't be in his establishment. It's against state law. Besides that, if we're talking about the flavor, when it says lemonade or juicy watermelon, those aren't things that I feel myself nor the board members have to open those when this wasn't like, oh, it's pink. These are flavors on the product. And if anyone who had reasonable faculties about signage, it's a vapable product. The strand of the hemp is lemonade. I mean, that just, it goes beyond anybody's common sense that you wouldn't consider that flavor. I don't need to open it up. If you're labeling that it's a flavor, the assumption is to everybody who's buying it that it's a flavor.
So if somebody through genetic manipulation managed to cross an apple with the tobacco plant so that the leaf was flavored with apple, it was right from that tobacco plant, but it would still be considered flavored. Is that right?
Exactly.
Okay.
So the only question I had.
This is like deciding, you know, someone would ask me, like, you know, is there a difference between apple and cider? I mean, you know, it's the same. It's derived from the same plant, even if you mixed it. And if it says it's banana, we wouldn't have to assume that it's banana flavor, or it was crossed with some banana derivative, or infused with. Actually, this board specifically addressed a product that was a tobacco product with another retailer, and we found online the simple word of infused was enough to indicate that it was a flavor.
The other thing is, I understood when we first got into this discussion that the only allowable flavor was tobacco flavor, and that anything other than that was a flavoring. So presumably this hemp product doesn't taste like tobacco.
So another question I had, I apologize to cut anyone off. So upon what I'm hearing, so what is the difference between a dispensary, because a dispensary has cannabinoid products or CBD products or hemp products or any cannabis products that do have flavors that are naturally derived and naturally manufactured in their dispensaries, and there's hundreds of dispensaries in the city that are opening that have, you know, cartridges with THC, with natural flavoring or natural strain of all these flavors that we're talking about. So I mean, this is a big dilemma for any retailer, because if every flavor that you consume or inhale, or any strain that is naturally produced or synthetically produced is consumed or inhaled is under the tobacco law, then
Are you a dispensary? Are you
I'm
a
not a
dispensary?
dispensary. No, I'm not.
So I don't think
But
those
I'm
rules
just
apply
trying-
to you, though.
No, but the law states that what I'm hearing is that this goes across the board for anything, right? Because we're right now I'm being governed under tobacco law, and I'm trying to understand why am I being penalized for not having not having a strain product that is naturally manufactured, but which is not a tobacco product, but it's under CD's Cannabis Control Commission or whatever department that actually handles that product. I'm not being penalized by them, but I'm being penalized by tobacco law. So I'm a little shaken up by the whole situation that if everything is controlled by flavored tobacco law, then why is every dispensary or any retailer that even carries CBD or vapable CBD or hemp CBD or any of these products have these products in dispensaries as well? Because then law is a law. It doesn't matter what department is handling it.
Actually,
It's
Dee,
still
I'm sorry, Mr. Patel. Dee, I just want to answer one thing quickly. You have your hand up and I want to give you a chance to, but the difference is a marijuana dispensary can't sell CBD unless it has the number that's above what's allowed at a retail level. So we don't govern that. That's the Cannabis Control Commission. And the Cannabis Control Commission doesn't govern a regular retailer because you're not supposed to carry anything with the THC amount that a dispensary would. And if there was a problem, the CCC goes in and they deal with the dispensaries, but they're not able to carry these products if they don't exceed that level. They're exclusively cannabis with that number above what a regular retailer can carry.
And they cannot carry tobacco either.
Correct. I think Dee had a question. I'm sorry. I saw his hand raised. Now he's off my screen.
I apologize for all the questions. I'm just understanding the situation so that way moving forward I know what direction I need to be in, and I don't want to upset the board or the city or the state. As a retailer, I'm a small business, and mistakes happen, and I've paid for my previous mistakes, and I just want to understand where I need to be headed, and if manufacturing letters means nothing in the state's eye or the city's eye, then I need to just be extremely cautious and careful of what I need to do moving forward as a retailer.
And Nilesh, this would be an example of, I would say to you, as an adult-only establishment, which you have some benefits that other stores don't get, is you should also know, if you're questioning where the cannabis committee or cannabis control or dispensaries, why are they different, you should know that. Like, that shouldn't be a question 2 years into your business. Like, you should know that just because you're different from them, and that's important for you to know.
No, I do know that, and I just didn't understand. If I thought that, okay, when the whole vape ban happened and all the everything that trickled down throughout the process, I wanted to understand, what is the law, and my specific understanding through my attorney and through all the cities that I'm doing business in has told me that I need manufacturing letters for the products, and I need to have non-flavored products, and I need to all the guidelines, and I've met every guideline. And again, this is the first only guideline that obviously wasn't, I mean, it was, whether it was a mistake from my end or not, I needed to understand, because I was not aware of, a manufacturing letter and the synthetic products and the differences and So I thank you for answering as much, all the questions, and I apologize if I'm wasting anyone's time. I just
Does-
needed to
can I-
understand it.
Can I ask something? If a retailer in the situation has a new product that he wants to sell, can he call you and ask you whether this is allowable or not? Can they get sort of pre heads up? Like if he wanted, for instance, to sell Delta 8 products, would it be appropriate for him to call you and say, can I sell Delta 8 products?
Doctor, are you asking me that question?
Yes.
Yes,
Sorry.
they can, and they have.
Okay.
Yeah.
So that would be the route I would go. I mean, if there's anything even the least bit questionable, it's not a standard thing that.
And Sheila, your question, I don't know why. I'm sorry, I don't feel like
No,
I'm
thank
running
you,
the meeting.
Joyce.
I feel so bad, but I see your hand up and I'm like, I know I'll talk,
That's
so.
okay. It's all right. I want to go back to something that was said a little earlier and make sure I didn't misunderstand it. Did someone say that this Delta 8 is a controlled substance? And so in that case, it shouldn't be sold at all, correct? Regardless of whether it's flavored or not flavored.
Absolutely. However, I will say that doesn't, because that's a controlled substance, we wouldn't be the enforcement agent for that. The police department would be. And that was
Okay.
one of the reasons why I had a police officer with me at the time. I didn't know what steps he would want to take. And he felt confident that based on the information we provided Mr. Patel, that it would be gone. And he actually independently went back out to ensure that these products were off the shelf. So that was beneficial to us. And, a lot of times the police department it's very difficult for them to prosecute on like one thing, but they'll have them remove it or they'll confiscate it, which I know has happened at several establishments in the city of Peabody. They've actually taken the product out and confiscated it. And I'm alarmed because the product, the brand is cake. The labeling is, if not flavored, it's deceiving. Very appealing to young people. Young people aren't supposed to be getting into his establishment or others, but now I've also come across food products that are Delta 8 products with the names like Skittles, and that's not this
That was the thing
establishment.
is
We
Halloween.
are seeing a lot of this.
It's completely alarming. Unnerving.
I'm sorry. I had my hand up, Mr. Chairman, and somehow I lost connection here on my computer. Can anyone hear me? I'm logging in from my phone now.
Yes.
As a backup. I had few questions. I'm not sure what Joyce said or what was covered when I was offline. The first observation that I'm going to make is this seems to Mr. Patel and Mr. Madoff, there's a difference between nicotine product and tobacco product. And I think the definition that Mr. DJ gave earlier indicates that, because the argument here is that it wasn't a tobacco product and it wasn't a flavor product. So if we come back to those two appeal arguments, we should, number one, agree that that was a tobacco product because it was either something with vaporization or aerosolization, if I can say that word. And with the definition on 105 CMR section D, that becomes a tobacco product. Now, as far as the flavor part of it, that's a different story, but we can at least be in agreement that that was a tobacco product. My question to Joyce is the responsibility of the establishment to figure out if their product is legal or not. That I understand. Where are they supposed to get that information from if we can provide it to them? Do they get it from the manufacturer?
I would say because, and I've, in any training or any opportunity I have, is that these establishments, and I even mean this as just a regular retailer, not exclusively adult only, but it matters. That there are, a manufacturer could come to any establishment and say, look, I have a letter that says this is legal in every state, and you should be happy with that letter. But it is your due diligence as a retailer to do some search on these products, especially if they're new. And so I've seen a letter from a manufacturer of Delta 8 that said, oh, we're legal in 44 states, and Massachusetts wasn't on their list. But it's a simple search on mass.gov. And if you go to mass.gov, it's clear. In fact, for the record, I am happy to just read. It says is Delta 8 THC from hemp. That was the question. It says, because Delta 8 THC is not naturally occurring in hemp, except in possible trace amounts, to produce Delta 8 THC in commercial quantities, it must be derived from hemp synthetically. While the Farm Bill did remove hemp from the Controlled Substance Act, it did not impact control status of synthetically derived cannabinoids. Thus, Delta 8 THC remains a controlled substance regardless of the source. As a result, we do not allow hemp derivative Delta 8 products to be processed or sold in Massachusetts. And that's on their mass.gov. So, you know, I would say, yes, the onus is on these retailers to know, especially the stuff that's coming into their type of establishment, because there's also these other things that aren't regulated from the FDA. One of them would be Kratom, and it's Kratom. I would recommend that the board just Google it. You know, it's a naturally occurring leaf from a lot of Asian countries, but you can get high from it. And you know, the Board of Health could say, we don't want Kratom in Danvers. We just don't want this product, no matter where it comes from, no matter what letter you have. If you do research, this says, you know, there's a lot of concern for health. There have been overdoses associated. There have been deaths. You could, at the local level, as a Board of Health, you could regulate that at least out of the town of Danvers. So the due diligence is partially on us to do a good job educating our retailers, which I feel we do. We've offered trainings. We go in at least once a year. We provide signage. We talk to them about products that they can and can't have. But we, you know, every month there's a new product we're unaware of until we do our research or find out from either government sources or doing some research online what these products are. So they have to be aware that they have to know federal law as it pertains to them. They have to know state law as it pertains to them, and they have to know local regulations or ordinances as it pertains to them. And what you missed is the doctor asked if it was appropriate for a retailer to call me and say, I have this new product, is it okay? And in some cases, I'll say, I'm not 100% sure. You know, let me look. But if I come and I see it and I get a sense of it and I do my Google search and my research, you know, this is when we make these decisions, that it falls under a category we should be concerned about, you know?
So basically what I'm hearing is on mass.gov, that's a source that the retailer can use to see if their product is legal or not.
Correct.
Is a letter from the manufacturer also another source that they can use?
They can, but as I indicated, they're not always. The manufacturer is in the job of selling a product to their retailers, regardless, and they don't always know local laws. So they come in with a letter and say, it's legal in 44 out of the 50 states. And in fact, Massachusetts, as I indicated, wasn't listed on there, and it isn't legal here. So I would say there's misinformation from some of these manufacturers, and the onus does fall on the retailer to make sure that they know what they're selling. I mean, ultimately, it comes down to their work as well.
Okay, and then another question that I have. Sorry, Mr. Chairman, I had a list of questions and I got. So, is it banned in Massachusetts because it's a controlled substance or because it's a flavored tobacco product?
It's banned in Massachusetts as a controlled substance and as a flavored product that's vapable. So if there was something, and there are Delta 8 edibles, they wouldn't fall under the same category for us to enforce. It's because it's flavored and it's vapable that it falls under the tobacco regulation.
Okay, so that flavor vapable aspect of it,
Correct.
that makes it banned in Massachusetts. Where
And
is
the controlled substance part of it.
yes, yes. No, if I only focus on the flavor vapor
Yes.
part of it, because we don't have jurisdiction over controlled substances.
Correct.
If I focus on the flavor vapor part of it, where is the establishment supposed to get that information from? If it's
That's
not
right
on
in state
mass.gov.
law. That's right in state law, which DJ read. The definition is anything vapable. And we sent out a summary of that law to every retailer when the state law was coming into effect for June. But these retailers got additional information because of what had been in place since September of 2019.
Mr. Chairman, I have a couple of questions for Mr. Patel or Mr. Madoff.
Okay.
So the inspection happened on the 14th. And by the way, do you still have the products on the shelf now? Have they been removed?
It was removed the second Joyce mentioned that I'm not supposed to have it. It was removed upon her request as she was in the establishment. And then I did do my research and then asked to understand if I needed a manufacturing letter, which I provided all the manufacturing letters for all the products that I had on the shelf.
Okay.
And at that time, I didn't understand I was under violation. And that's why it was such a shock, because I had no idea that I was under violation for a product I had a manufacturing letter for.
Okay, I understand that, but from the notes that I saw, the inspection happened on the 14th, and the sergeant came to your establishment on the 19th, and the product was still there, and that was 4 days later. So and
it was removed when he came for inspection.
So the product was removed after the sergeant came on the 19th?
No. The product was removed immediately when Joyce and the officer was in the establishment initially when they were doing the inspection.
Well, Joyce, it appears the note says that when the sergeant got there on the 19th, the product was still there.
Correct. Just so you know, the 14th was not myself. It was one of our inspectors who had indicated that she thought that this was a product that should be removed because it was flavored. We went back on the 19th and it was still there.
Okay. Now that clarifies it for me. I mean, I have kids and I don't smoke. I'm not a fan of these products, but I seem to have a little sympathy for Mr. Patel if the manufacturer is telling him that these products are not flavor or vapable, unless I'm not quite sure where he has a clear answer to that. Because these 2 letters from the manufacturers that we received, they seem to indicate that those 2 are not flavor or vapor. Now that we've established it, obviously, I hope he doesn't sell it anymore, at least because it's even a controlled substance, so they shouldn't be having it. So I'm not quite sure. I don't know. I'm torn because not knowing the law is not an excuse, but I sympathize with the fact that the manufacturer is telling the establishment that this is not a flavor product, this is not a tobacco product, but then the law is also saying that it could be one. So I'm not sure how to sort that out, Joyce.
Well, the only thing I can say about the flavor is that it clearly indicates he didn't have a manufacturer's letter prior to our inspection. So he didn't know that. And if it says it's vape, which he's a vape shop, so he certainly knows what is and isn't vapable. And it says it's lemonade. He didn't get a manufacturer's letter saying this was all okay until after we addressed the issue with him. So I would just say, again, it's pretty, it doesn't take a big leap to realize that if it says it's lemonade flavor, that it is a lemonade flavor, and that it was vapor. His concern that day was just that he didn't think we governed hemp. And
No, but at that time I didn't mention, sorry about that. I did mention that I have the manufacturing letters. I just need to reach out and get you the manufacturing letters immediately. And which I did. I reached out and I got the manufacturing letters immediately because what I was notified from the second I received the products was, and you saw the shelf was completely full because I barely sold any because it just arrived. So immediately I received the products, and within the same time frame, 1 to 2 weeks, we had the inspection, and I received I received your opinion on the whole matter. So I immediately told you when you were there with the folder of all my compliance letters that I have the compliance letter. I'll get it to you immediately, which I did. I forwarded the emails because I knew the compliance letters were coming, and this is new. Most actually all states, not a single state requires a manufacturing letter for every product that you sell. So this is very new for 99.9% of every product, including Jewel, that provide a manufacturing letter. So Massachusetts is the only state that does that. So most manufacturers don't even do it for you. And I rubbed every back I could to get me the letter with their signatures on it to prove that that's what they told me. And that's what it was a little bit like, oh my God, I think I made a mistake, or what's going on. I'm trying to figure out where did I go wrong. And that's where the understanding, I'm just like, I don't know.
Can I just, even with the manufacturer's letter, I was just looking at it and the flavors listed, I know they're trying to say it's not flavored, but it's pancakes, PB&J, strawberry cough. I'm not sure how that's not flavored.
That's not a,
It just,
can you imagine that that's a strand of hemp, peanut butter and
No.
jelly?
no, and if that's what's labeled on the product when you're selling it, to me, that's clearly flavored.
And the product itself is illegal.
Correct.
I mean, we really, I think, are arguing about something that the product is illegal and what flavor is it is less important.
However, I just remind the board that that's our jurisdiction. Like
Yeah.
our jurisdiction is the flavor portion.
Right,
So,
right.
Everything is flavored. Minus. All I want
Okay,
to
well,
say.
we have nothing further, I think, to say on the matter, unless you have questions.
Well, do I hear a motion from anybody about accepting or excuse me, of continuing the fine or negating it? Do we have a motion to do either?
So I want to just clarify, the fine is already there and we would just move to keep it
Or
or
dismiss?
move,
Yeah.
dismiss it.
Yeah, I think, based on everything that I hear, the appeal was to say that Delta 8 is neither a tobacco product nor a flavor product. That was the reason for the appeal. From what I'm seeing and what I'm hearing, Delta 8 is a tobacco product based on 105 CMR Section B because of the vaporization and the aerosolization, and based on the manufacturer data, it also appears that Delta 8 is flavor. So on those two bases, as much as I sympathize with the retailer, unfortunately, I think personally my hands are tied. I'll have to follow the law in
Right.
this matter. I hate to do it. But I'll move that I'm not sure how you say this. That the fine stands as imposed by the town.
I second.
All in favor? D,
Yes.
Sheila?
Yep.
I say yes also.
If I may, we've also asked that the suspension be reconsidered. I don't know if that's a separate matter for you, or if when you're talking about the fine, you're talking about both.
I would just say that the state law says a fine of $2,000 and a 7-day suspension. So I would just remind the board that it is all one piece. If you want to break it down, that's fine, but it is one violation.
Well, I mean, I just think that first of all, if you're in a business, you should know everything about that business. I know that as a physician, I would not be excused from making a mistake because the drug rep came in and told me I could do this, and I should have known enough to check and find out. So if some company says, yes, this is not what you think it is, you can go ahead and sell it. It's up to you to make sure that they're telling you the truth. So it's clearly what did not happen here.
If I can just interject and say, according to state law, it's the $2,000 fine shall be imposed, and a prohibition on the sale of tobacco products may be imposed for at least 1 day and up to 7 consecutive days. But I suspect your personal regulation already has in it that you've been doing that all along. Yeah, you do a shall suspend. So in keeping with the tenor of what you have been doing locally, but you do that wiggle room according to state law.
Yeah, I think the regulation, as we had with Mr. Chairman, is shall, is both. It's not either.
Yeah.
Or.
Right.
It's the fine and the suspension. And,
Right.
and I think we've had a situation like that before as well.
Right. Exactly.
When would it be in effect?
Well, I think that you worked that out with some of our staff people as to the date. Aaron, is our new person going to be in place to make that decision, or?
The new person will start on Monday, the 24th. We'll be happy to work with Mr. Patel between now and then on finalizing the details. And if that slides to the 24th, then so be it. But we'll work with Mr. Patel in between now and then. And I'll touch base with our new health director just to make sure he's aware of what's going on.
Okay.
Thank you.
Thank you.
Thank you. Thank you so much, guys.
Okay. So Aaron, if you need me for anything, just reach out, and if you need a letter, you know, you may or may not. I mean, I know there's a template in Danvers because we've used it for another retailer, but if you need another template letter to start, I have that available.
Excellent.
Thank you, everybody. Have a wonderful night.
Thank you.
I see from all the initials on the bottom of the screen, we have visitors.
We have, like I said, I think at the end of the day, we had about 11 or 12 members of the public who requested to attend tonight's meeting. We did let them know that under the COVID-19 update, there may be an opportunity afforded to them to ask questions or make statements. Obviously, that's up to the discretion of the chair of the meeting. There is not a public hearing. I know in general, I think under this item, Judith usually provides an update of what's going on with COVID. So I figured you may want to run through some of those items.
Okay.
Then you guys can decide how you want to run the public comment. I would say if you allow public comment, we're probably going to need about 3 to 4 seconds lead time, given that I have to enable the microphone. And then if you are asked to speak, you'll need to unmute yourself from there.
Okay.
So it might take a little second to get everything going.
Okay. So do you want, so we hear from Judith first, or?
I think that would be the right thing to do.
Okay.
Oh, and I gotta enable her mic. Okay, so now Judith, you should be able to unmute yourself. No,
Well, there's a funny little game piece up in the upper left-hand corner of mine. I don't know who that is, or.
no. When you unmute, you're not seeing your unmuting. All right, come ride shotgun with me. Sorry, everybody, there's a little, Judith's computer does not like her tonight. Oh, D, you back on your main machine. I gotta. Now, D, can you unmute yourself?
Yes, thank you.
Okay, good.
Can I sit in yours?
Yep.
Hey, everybody. I am having some major technical difficulties tonight. All right, so let me just start with the non-COVID. My usual report for the month. So non-COVID, reportable diseases, we had one confirmed Hep C. We actually had 23 flu this month, so up from last month. And as I said last meeting, more than usual for this time of year. We don't start seeing until, February, the increase. So we definitely have seen increase in the past few years. And as of this report, they've all been A. We have not had any B flu strains at this point. One varicella, and that was it as far as those. No foodborne illnesses this month, which is a good thing. And then to jump into COVID, I can tell you as far as clinics go, we're still doing booster clinics. We're doing it for adults. We have not done any kid boosters. That just came down the pike just recently as far as the okay goes, but we still need one more green light to be able to do that. I'm not sure if we will be doing those in Danvers, but we're doing the adult boosters at this point, and the majority of those are Moderna clinics, going around to the different cities and towns, helping them out. We have some upcoming here in Danvers, and we're also working with Cataldo to do other clinics. There was one a couple of weeks ago, looking to open up some testing sites here in Danvers, or a testing site here in Danvers, again, working with Cataldo, so.
And I think sorry, I'll jump in on that one. I think I told you in an email earlier, we had an event for this Saturday because of the snow. We're gonna have to cancel that because we have a logistics problem. So we're looking at a couple of events next week. Unfortunately, Saturday's not gonna work.
And that will be for testing, is that right?
That's testing.
Okay.
Yes. In the problem is that testing, as you well know, all over is just really, really difficult. But the state has changed, has kind of lightened up the guidelines a little bit. So instead of saying that testing is required at this point, they're saying it's recommended and test if possible when you're coming out of quarantine. So to lighten up the quarantine regulations. All right, so for our numbers, it's I've been doing it weekly this week, so I do it from Thursday to Thursday.
Steal the mouse. Sorry.
I ran it a little bit earlier than usual, so I usually run it at about 9 o'clock at night. But for this week, we had 494 cases since last Thursday. And just for a comparison, we had the week before, we had 467. So it's still on the upswing.
And I plugged all of Judith's numbers into a chart going back to early September. And hopefully you can all see that on the screen right now. Just again, we have these numbers available. But just I thought it was quite dramatic to see what's happened in the last couple of weeks.
So, and then, as far as these numbers go, same as it has been over the last few weeks, the they're not, the difference between this year and last year at this time, it was, a lot of facilities. So those long-term care facilities, assisted living, group homes, it's again, still not, I mean, they're trickling into those facilities, but that's not where all our cases are. At one point, a few points last year, we could have said, yeah, the majority of our cases are all in those facilities. This time, up until now, it has not been the majority of cases. So trickling, a few here and there in the different facilities, but that's not where the large amounts are coming from. It's just widespread out in the community. A lot of business. Say that again.
More in children? Is the age group swinging downward?
We're seeing in a lot of little kids. Yep.
Yeah.
Yes. Yep. From weeks old to, right up. So yeah, it made that progression. So now it's down into the little ones, the younger ones. Still definitely seeing, and I don't have numbers, but the individuals that are in the hospital are the non-vaccinated ones. I think a few months ago, I was able to pull out and tell you that we had a couple of people that had some severe underlying issues, and they were in the hospital, even though they were vaccinated. As of right now, since last month, I think it was, none of the ones that are in the hospital have been vaccinated at this point. There was something else I was going to say, and I cannot remember. Lost my train of thought. It was just before we were talking about the age group. I don't remember. Anyway. This is what happens when I, my flow gets interrupted. The old brain there. I think that's it. Any questions? Oh, I know what I was going to say. I was going to say businesses. I'm getting a lot of calls from businesses with cases. And interestingly enough, they're actually not, since the state of emergency was lifted back in June 15th, they were not required any longer to report cases. They're reporting it, which is awesome, but it's a lot of businesses. It's flying.
What do you mean businesses report cases? Their employees?
So of their employees, yeah.
Okay.
Yep. Yeah, they were required during the state of emergency. They were required to report all their positive employees, and we had to make sure that they were doing all their preventative measures and all that stuff. And so they're still doing it. And getting in touch with me. There's many businesses that a couple of them have asked about shutting down, and we're not shutting them down right now. We're just telling them if you can't staff it, then that's going to be your decision. And that's it for me.
Okay.
Thank you.
Thank you.
Thank you, Judy. I mean, it's Mr. Chairman.
Yes.
Yeah, it's just amazing how, those cases are going up. I was just looking a little bit for comparison from our from our November meeting. In October, for the month, we had about 190 cases. Then in November, for the month, we had 286 cases in town. But yet last week alone, we are at almost 500 cases.
Right.
I mean, that's a huge jump.
Right.
That means that we are really in the middle of the crisis here. And the problem is that even if it's only 12% of people in the hospital, because I was speaking to someone who said, well, everybody in the hospital doesn't have COVID. People go there for other things and they get tested, and now we see that they have COVID. But the problem with that analogy is that if it's only 12% of patients who have COVID in the hospital, they're using almost 40% of the hospital resources.
Right.
Because once you have a patient with a COVID, they have to be isolated. So if you have a room that could take 4 people, you can only put 1 person in there.
Right.
The nurse that's taking care of that COVID patient can't take care of the other 4 patients anymore. The use of PPPs,
Yes.
she had to change every time she goes in and out of the room. It's just a lot involved of to this than just the number 12% or other comorbidities that the patient may have. So I think that we have to stay vigilant because we are right in the middle of it. To see this increase is outstanding.
Yes, and it's everywhere in the country. It's not just us.
No.
In other parts, it's much worse. I mean, New York is, I think, averaging. They're up to what they had in the high 50,000 cases today.
Yeah.
So this is worse
Yeah.
than it's ever been at any point in the pandemic.
Yes.
And
And
you
it
know,
is a huge strain on the hospitals right now, like a huge
And
strain.
it's showing in other ways, as Dee was just mentioning. Somebody in my office, their mother had a fractured ankle at home, fell in at home. She can't get to the hospital. There's a 14-hour wait.
Yep.
And so that's because there's so many, and it's not all patients with COVID, but they're squeezing out the normal flow of emergency rooms and admissions. Because as Dee said, they're taking up much more of the resources than a normal patient would. And this is going to affect people with heart disease and cancer and diabetes. So the deaths from COVID are not going to be reflected in just people that died directly of COVID, but all these other people as well.
Right.
And I was just listening to a report today that the number of pediatric patients in New Orleans has tripled the admission. And they've had 1,000 deaths, pediatric deaths from COVID in the last 6 months, which doesn't sound like a lot compared with 800,000. But these are children who it takes a lot to knock them down, and get knocked down by this.
you know, one of the things that somebody asked me the other day was, well, aren't the numbers larger because so many more people are testing? And, you know, they don't realize that positivity rate. So we've not had this high a percentage. I think it's over 22% for the state at this point. We've never had that before.
Right.
And, you know, we started out, I think this summer, it was well below, I think it was 0.01% this summer at some point, and it has slowly increased. Well, not slowly, just in the last couple of months, but.
And the thing is too, that a lot of the tests that are being done are the rapid tests, which if anything, suffer from false negatives. So
Correct.
There's probably even more people that are actually positive than we're picking up.
And you know what? You bring up a very good point, and that should have been something that I had brought up as well. Those numbers, so this 494 cases for this week does not count any home tests.
That's right.
So and just so that you know, we have no way to record home testing. I have a few people that have called me because their physicians have told them to, let the Board of Health know. We don't follow those individuals because they're not in our database. They don't go to the state database. And I know so many people that have home tested. So this number is small compared
Right.
to what is really happening out there.
Exactly.
Yep.
Okay, so are we going to take comments and questions, or?
Yeah. I think again, we had some people reaching out to us throughout this week. I would imagine most of them have questions about the mask mandate. That seemed to be what spurred the comments, but not everybody explained to us why they wanted to attend tonight and what they wanted to comment on, but that would be my impression. So if you guys want to take comment, I think we have a few people.
I'm willing to. I don't know if the rest of the board agrees with that.
Sure.
The only thing I think what I mentioned is that they should be somebody who's either a resident or a business owner in Danvers. I don't feel the need to explain our actions to somebody from Peabody. They have their own board to do that. So if we could screen them in that way, I mean.
I think as you recognize them, again, hopefully they're Danvers resident, and everyone just heard, we'd like to hear from Danvers residents and Danvers businesses. So
Okay.
don't cheat on us. I think, as I said, it's going to take me a second. Once you recognize somebody, I have to enable their mic. Then you're going to unmute yourself once I enable your mic. And I think, I don't know, Dr. McLaughlin, do you want me to just, I see some hands up. Do you want me to just go and?
Yeah, well, why don't we say, we'll start with 3 minutes. I mean, I don't know whether there's some may go over that, but that's a guideline.
Okay, I got a timer in the corner here, so we'll monitor the timelines. I think the first hand I saw up was, it looked like a MS, maybe it was Mark something, but I'm going to allow this microphone. And now if this person could unmute themselves, I think it was Mark Smith.
Yes, can you hear me?
Yes.
Great. Good evening. Thank you for the opportunity to speak. I am a Danvers resident. I don't think anyone else could have sat through that smoke shock hearing for an hour, so we're all Danvers residents. I have a brief statement I prepared, so if you'll indulge me, if I go over 3 minutes by a minute or 30 seconds, I appreciate no bells. Thank you. In 1967, Martin Luther King Jr. declared to America that we were approaching spiritual death. It's clear that the soul of America as a nation that stood for freedom and liberty is dead. America as a nation is spiritually dead. And all citizens of America who perpetrate and continue these evil, false narratives have chosen to be slaves and serve the false idol of wealth and their own worldly vanity. I'll illustrate by briefly discussing the 3 lies used. First, masks. Masks were never designed, intended, or capable of slowing the spread of infectious disease. Masks are a symbol of obedience, of censorship, of breaking the social bond of people, destroying the village, and not allowing the soul to express itself, causing social isolation. There are countless studies, peer-reviewed, that show masks do not protect an individual or a community from viral infection or transmission. The latest study comes from T.H. Chan's School of Public Health at Harvard, confirming this truth. Masks, in fact, reduce our health, reduce the oxygen in our body, increase carbon dioxide, causing hypercapnia, neurological problems, and further our chances for becoming sick acutely and chronically by allowing for harmful bacteria to build up like streptococcus. Secondly, we were told testing was the way out of this pandemic. The PCR test was invented by a man named Kary Mullis. Dr. Mullis won a Nobel Prize for inventing the PCR test to study HIV and AIDS. It was not designed to diagnose viral infection. Dr. Mullis made it clear until his death in 2019 that the PCR was being misused by Dr. Anthony Fauci. And you can learn all kinds of things about Dr. Anthony Fauci from Dr. Kary Mullis's book, including how AZT was a known chemotherapy drug that was too deadly and toxic to treat cancer patients. Rejected by the National Cancer Institute, but Dr. Fauci used AZT on AIDS patients, partnering with the pharmaceutical companies to poison Americans and then blame a virus or a disease on their death. The PCR test cannot diagnose viral infection. The CDC just confirmed this by removing the emergency use authorization of the PCR effective December 31st, 2021. Because it cannot differentiate between COVID-19 and influenza. What happened with flu last year? Miraculously, it disappeared. Calling a positive test a case is a violation of science. It's fraud. It's medical fraud. A case is a laboratory confirmed illness, confirmed with a culture from a pure isolated virus. Thirdly, the vaccine. These investigational, experimental, new biological products that hijack the software of life by injecting into our natural bodies.
Over 3 minutes. Wrap it up.
Our natural bodies, a synthetic, genetically engineered, modified RNA instructing our cells to produce a protein that is pathogenic. The spike proteins encoded in the synthetic RNA has been shown to cause vascular and neurological damage to the body. As such, our body's natural immune system recognizes and attacks the protein, as well as any cells that are generating the proteins. This is what is known as self-attack or an autoimmune disease. We are instructing healthy bodies to attack themselves. Myocarditis, inflammation of the heart that is permanent and deadly.
I think we get the gist of it.
All right, I'll skip ahead to my final paragraphs then, if you don't mind. It's real brief. I asked the board not to participate in the creation of an apartheid state, setting the table for genocide. Do not be willful participants in crimes against humanity. If you fail to act because you fail to think, because you fail to see, because you fail to listen, because you fail to use your heart and soul, you are guilty of being complicit in this evil. We as a people need to embrace love, stop submitting to fear, which is of evil origin, and begin to love one another as our Father taught us through his Son, Jesus Christ. Healthy human beings
All
do
right.
not need to wear a mask. Test.
We don't have religious discussions here. That's your religion. It's not everyone's. Secondly, is most of the things you quoted are incorrect. So we've got enough false news without having more of it. That's enough. Thank you.
And Mr. Chairman,
Yes.
if I could comment, I don't think we necessarily have to comment after every speaker.
No, I won't.
But I feel obligated to say that the gentleman essay was out of order. I would like us to put most of the information as out of order.
Yep.
It was inaccurate. And I personally take offense that as we are gearing up to celebrate the anniversary of Martin Luther King, he's quoted in this manner.
Yes.
This is not right. And
agree.
using words like we want to be slaves. Do we know what slaves are? I personally, and now I'm putting my hat of the chair of the Human Rights and Inclusion Committee on for a second. This is not right. We should not turn a health discussion into words like slave or people who are obedient or an apartheid state. For people who have lived in places where true communism exists, I think the statement of the gentleman should be taken out of order because this is no way to quote Dr. Martin Luther King, who was one of the champions of civil rights and liberty in our nation.
All right. Next person, please.
I'm going to unmute. It's Leanne Keneally, I think. I'm going to allow the mic. Then you can unmute yourself and your 3 minutes. Well, it didn't work. Hold on. Sorry about that. Allow mic. Can you unmute now?
Yes, can you hear me?
Gotcha. Yep, your 3 minutes are on.
Thank you. On December 23rd, the Danvers Board of Health convened for an emergency meeting, citing a rise in positive cases of COVID-19. During that meeting, the Board of Health decided to implement an indoor mask mandate. As a Danvers resident, I have numerous concerns, not only with the mandate itself, but also with the manner with which the mandate was implemented. Number one, the current mask mandate is an all or nothing approach, which does not allow for medical exemptions or other exemptions for those who can't wear masks for various reasons. This must be amended. Number two, age 2 and up is as restrictive as it gets. The indoor mask mandate implemented in the early days of the pandemic by Governor Baker allowed for parents' discretion. Tell me why the Danvers Board of Health, in a time where vaccines are widely available and are meant to be our, quote, way out of the pandemic, and given Danvers above average vaccination rates, why does the Board of Health now think it's best to get even more restrictive by implementing such a sweeping mandate exclusive of exemptions and inclusive of the youngest members of our community? Where is the science in this? Even the World Health Organization doesn't recommend masking for children under age 6. At some point, and my hunch is that it's happening now, our youngest and most vulnerable citizens are going to have a much worse pandemic to contend with by way of a mental health crisis. Number three, each year in the November to December timeframe, we enter a period of time that is well known to incur a higher rate of illness. I believe the media and others call this flu season. Are we really surprised that rates of positivity for COVID are rising in this already heightened period of illness? When will we stop merely looking at rates of positivity and address only the real crux of the issue of this pandemic, serious illness and death? We cannot keep implementing mask mandates each time there's a period of spikes in positive cases. Healthy people should not wear masks, and if one is sick, they should be staying at home. I'd like to better understand what constituted the need for an emergency meeting on December 23rd. In Webster's dictionary, emergency is defined as follows: an unexpected and usually dangerous situation that calls for immediate action. Based on the data I have been able to uncover myself, I don't see why the Board of Health couldn't have waited 2 more weeks to allow for public comment. In the early days of the pandemic, there was a lack of knowledge of what this virus was, how it was affecting people, and how to effectively treat it. We are now 2 years into this with so much more wisdom and information. We need to learn to live with this virus smartly and not jump to emergency anytime there are more positive cases. Many people testing positive has 0 symptoms. This is not an emergency situation. Finally, I want to say, as a very concerned citizen of this great town, I will be taking a much more active approach in attending various town meetings to make sure that the officials put in positions, such as on the school committee or on the Board of Health, either by election or by appointment, are acting on behalf of all residents of Danvers and not acting on their own opinions or personal feelings. Thank you.
Okay, next.
Sorry, just gotta scroll down here. We heard from Mr. Smith. We heard from
One
Ms.
thing, now, does everybody hear us when we speak?
Yeah.
They all do.
Yep.
First of all, let's just clear the air a little bit here on just general, because I don't want to hear the same argument over and over again. Masks have been shown to reduce the spread of COVID. They are not perfect. Number two, children are not damaged intellectually, physically, emotionally by wearing masks. They are, in my experience, more eager to wear them than their parents are. So I don't want to hear any more of this so-called mental health argument about children wearing masks. It does not cause physical damage. It does not cause hypercapnia. It does not cause low oxygen. It does not cause increased infection. It prevents you from giving other people the infections that you have without realizing it. The fact that you are asymptomatic but still have COVID is the danger. You can give other people who aren't as lucky as you to have been vaccinated, you can prevent them from getting seriously ill. So please spare us the discussion about whether masks work, whether it's your freedom to infect other people. It's just not going to go over, and there's no reason to discuss it. These are public health issues. These aren't moral or emotional or legal issues. They're public health. We saw a great increase in the number of cases. We had more cases last week than we had in the previous 2 months. So this is an emergency, and that's not the definition of an emergency. We define the emergency for public health, not everyone else. We're an appointed board. We are not elected by anyone. We receive no salary. We work for the betterment of the majority of people in Danvers, apparently. But there are always going to be people that disagree, and they have the right to disagree. But to say that we don't agree with them does not mean we're not acting in the best interests of the people of Danvers. Okay, that's my piece.
Before I call on the next one, we'll go to Molly Henry. I just would also say procedurally, I did reach out to and communicate with the Attorney General's office prior to the meeting on December 23rd to ensure that we could post the meeting inside of 48 hours, and that was approved by the Attorney General's office. So understanding that it was an unusual circumstance based on the number of cases we were seeing, just want people to know that procedurally, I called the Attorney General's office on myself to ensure that the meeting could be held that evening, because I understood that this was an unusual circumstance. That said, I'm the next person who had a hand raised was Molly Henry. I am not related to Molly. I've been told there's other Henrys in town. I've never met them. So it's nice to see another Henry on the screen. And if you can now unmute yourself, Miss Henry, you should be audible.
Yep. Thank you. Yes, my husband's family has been in Danvers for 50, 60 years.
Okay. I'm married into this paradise.
Okay. Same here. Well, thank you so much for the opportunity to speak. I really want to just touch up on, we're really looking for an explanation on not only the mask mandate, but on the emergency meeting. I would love to see the document from the AG meeting. I would like to know for the record, although nearby towns such as Beverly, Salem, Gloucester, and Peabody all have higher case counts than Danvers, they still held a scheduled meeting with public comment. I also find it confusing that once the mandate was posted on Facebook, the Board of Health did not notify local businesses and headed out to a 2-week vacation during said emergency.
No.
Why? Please don't interrupt. Why would you put on an unenforceable, highly controversial, scientifically unproven mitigation strategy in place leaving the businesses to fend for themselves. It's a derelict of duty. There are several issues with enacting a mask mandate after the state of emergency has expired. First, Mass Board of Registration in Medicine, delegation of medical services. There shall be no delegation of medical services to an individual who is not licensed to perform those services in Massachusetts. A mask is defined as PPE by the CDC. Therefore, any business cannot enforce such a mandate without a medical license. The responsibility rests solely on the Board of Health. Civil Rights Act of 1964, Title II, unlawful to discriminate in a place of public accommodations. As you know, public accommodations are defined from anything from restaurants, hotels, retail stores, museums, libraries, daycares. You cannot expect local businesses to open themselves up for litigation to enforce your mandate. In terms of enforcement, since this is a mandate, the town police cannot be called. All businesses should be provided a direct phone number to the Board of Health inspectors so they can report any incidences. In addition, businesses cannot ask for information on exemptions or disabilities that prevent a person from wearing a mask. There's so many fallacies and legal violations on your boilerplate mandate. Why did you think this was acceptable for a town of 28,000? The only thing this mandate does is placates people who are afraid of healthy people. You are encouraging a volatile environment with people blinded by fear. Have you even contacted the businesses yet? You ask them to shoulder the burden, yet you don't ask their input. As a resident with many friends that own businesses, I ask, the ones I've spoken with are furious about the fly-by-night mandate on Christmas Eve, some of the businesses' busiest days. They understand the reality of what this mandate means. They will lose business, they will lose employees, and they will deal with confrontations. You still have not contacted them and expect the social media accounts and websites to do your bidding. To wrap up, our own governor said, I have no interest in putting a mandate on this issue, given all the tools that are available on a statewide basis. We issued a mask mandate last fall because we had no other options. Does the board not believe the people of Danvers are sensible enough to take their own precautions and need town officials to step in? Remove the mandate. It's been 22 months. The businesses have had enough. Thank you.
Next is a phone caller. It is 617-818-5994. For the record, if you can just state your name once I unmute you, you'll have to unmute yourself, but if you can give us your name. This was 617-818-5994. You just have to unmute yourself.
Can you hear me?
Yep.
Yep, Ashley Malloy. I am a Danvers resident. I am also calling against this mask mandate. I have a really hard time following guidance from a physician who denies vaccine injuries and doesn't even know what VAERS is. It's right on the back of the CDC vaccine card.
Ms. Malloy, I would say that's called an ad hominem attack. You can't, it's not about the personalities. It's an ad hominem attack. It's out of order. So you got to stick to the issue, and you can continue your 3 minutes.
This is completely relevant because he's putting policies in place for the entire town.
Okay,
And
if you don't want to back off, I'm going to have to kill your audio.
Excuse me. Okay.
Speak
So
to
by
the issue
virtue of
or
the
you get cut off.
Okay. Stop interrupting me. Start my 3 minutes over. There is so much negligence in this mask mandate, I don't even know where to begin. So by virtue of possessions, this board possesses neither the expertise nor the authority to force the use of any product or medical device under emergency use authorization in a population of 28,000 people. This board has never acknowledged that masks are EUA, nor has it properly educated the public or businesses on the full scope of long and short-term risks and benefits, the majority of which are still unknown. And yes, there are significant mental health impacts in children, speech, cognitive, developmental, you name it. And if you neglect that, we're in for a world of hurt as this goes forward. The lack of transparency surrounding masks as EUA deprives residents of the ability to exercise informed consent or right of refusal as outlined in federal law. Throughout this pandemic, the vast majority of transmission has occurred in private residences among people who gather, not in stores where interaction with strangers is fleeting and people are constantly on the move. and forcing people to wear a mask from the door of a restaurant to their table, where they will spend an hour maskless, eating and drinking, is unscientifically asinine. At this point, the tools against COVID are available for free to the general public. States with mask and vaccine mandates and passports are not faring any better than those allowing citizens freedom of choice. The statistical data is available for the public to fact check. And finally, the notion that we are all in this together, this is a public health crisis, that we need to do this for the greater good, is well past its time. I don't know anyone who is doing well mentally or emotionally now, and mental health, believe it or not, is critical and of equal importance to physical health. If people themselves are not okay, you cannot expect them to continue to live every facet of their lives protecting other people. In a true emergency, we need to put on our own oxygen mask first before helping others, or everyone suffocates. This is not sustainable, and people who are struggling with masks should not be viewed as lesser than or selfish because we understand they are ineffective mitigation strategy and simply cannot take it anymore. I am asking the board to rescind this unscientific mask mandate as soon as possible. To support this request, I would like all of your email addresses so I can send you a notarized affidavit from an industrial hygienist who is a subject matter expert in PPE, which none of you are, on aerosol viral transmission, which explains in detail why masks do not protect from COVID-19 or any other aerosolized viral pathogen.
All right, thank you. There's one more hand up. This is Sandy. I don't see a last name. If, for the record, I'm going to allow the microphone. You have to unmute yourself, but if you can identify yourself for the record so we can get it for the minutes.
Yes.
Your
Can
3
you hear-
minutes starts now. Yep.
Okay, my name is Sandy Francischini, and I am a Danvers resident. I did have something written out here, and I would just like to read it and not be interrupted, please. I am still trying to understand what constituted the Board of Health to make the determination that an emergency meeting was needed when there was no emergency at state or local level that would have warranted such. Emergency meetings are defined by the Mass Open Meeting laws as a sudden or generally unexpected occurrence or a set of circumstances demanding immediate actions. An increase in illness during the winter months with faulty tests that cannot tell the difference between flu, cold, and COVID is not unexpected nor sudden. High cases do not equate to high hospitalizations or high death rates. The town has not supplied us with sufficient information regarding the need for the emergency meeting. The town website does not indicate the full spectrum of reference to the COVID statistics in our town. I have logged on to web pages of surrounding towns, for example, Gloucester, Rockport, and Salem, and was very pleased to see that they had quite a bit of information that residents and business owners can obtain and review. Correspondence has been sent during this, requesting this data for requests and mask mandate letters to ensure that all Danvers residents and business owners are notified. And to insinuate that these letters were sent as punitive just underscores our frustrations being heard. In addition, would like to know why the town felt a mask mandate would be the best answer. We've been dealing with this virus now for 22 months and it's still ongoing. We've tried this tactic already and it hasn't solved or cured or did away with the virus. This virus is going to stick around and thankfully has been weakening, thus bumping us into an endemic, though nobody wants to hear that. We need to learn to live with this virus and be able to live our lives and continue on. Wearing masks again isn't going to change the outcome. It hasn't done so previously. Masks should be a choice and let residents and business owners have a say in that, how they want to use them or not use them. I feel force is not the answer. Thank you for your time.
Thank you. Next hand up is Walter Mallon. Give me half a second to enable the microphone. If you can then unmute yourself, your 3 minutes starts now.
Hello, folks. My name is Walt Mallon. I am a Danvers resident as well. Can you all hear me all right?
Yes.
Okay. I'm a Danvers resident. I'm also a senior health and safety official for a large company in Massachusetts. Without going too far with it, would like to talk about masks just a little bit. Primarily, I'm gonna kind of direct this more towards the guest on the call than the board. I mean, no offense, but I think you guys have already made up your mind, and this is a formality at this point. So I'm going to speak to the residents that are on the call. Paper masks, from an occupational safety health standpoint, paper masks are again, just like it's been stated, primarily ineffective, and I can actually put numbers and data to it. In terms of wearing a paper mask or your run-of-the-mill CVS standard surgical masks, it's about 11% effective at actually trapping airborne contaminants. If you look at it a different way, there's an 89% chance that mask isn't going to work for you. So another thing is a lot of people, and for the folks who have these available, is the N95 mask. Now the N95 mask in a perfect environment, controlled environment, I'd like to reiterate that, a controlled environment. So from an industrial standpoint, in a controlled environment, an N95 mask on a clean-shaven person who's been fit tested and medically cleared to wear this mask, they're about 95% effective. Now, if you've got facial hair, even some scarring, you can't ensure a proper seal of the mask, which obviously decreases its effectiveness. It goes without saying, I feel the same as the people. I mean, you can obviously hear the frustration in our residents here. A mandate, I don't believe, is going to solve the problem. I think we need to do a better job of communicating to people that if they're sick, stay away. In a choice, if you're not comfortable being around other people without a mask on, by all means wear a mask. I'm not going to look down on anybody who takes that time to put a mask on in an attempt to, protect themselves. Now, another thing when it comes to personal protective equipment, I know I've heard quite a bit of people say, well, you're wearing a mask to protect the other guy. Well, that's kind of not the definition of personal protective equipment. Personal protective equipment is designed to protect you. So just with that in regard, that's kind of all I wanted to say. But, and you can also look at it this way. If I put a parachute on you and I still put you on the edge of an airplane, and right before I pushed you out the door, I told you there's an 89% chance that this parachute's not going to work, would you still take the jump? That's all I got. I appreciate the time. Thank you.
Okay, thank you. Last hand is Mr. Morose. Let me enable your camera, and then you'll unmute yourself, and your 3 minutes is a go. Oh, you got to unmute yourself, Jim. Sorry, you got to do that part for yourself. It's not working. For folks, other folks, a little on the fly IT help. Is the mute button, for me, it's on the top right, but for you guys, it was down towards the middle?
Lower middle.
Lower middle.
Same with me.
Okay. Jim, I'm gonna disable the mic and go backwards and see if that helps a little bit. So hold on, I'm gonna disable and allow. Any luck? We had a little luck. We had a little luck before with people leaving the meeting and coming back in, and then it seemed to work. If you want to exit the meeting and come right back in, we can try that. These virtual meetings do not always go so smooth. Nope, Mr. Morose is right back in. Let me enable the mic. Mr. Morose, can you unmute now?
Can you hear me?
Yep.
Okay. Thank you very much. Okay, so I didn't have anything really prepared to say, but I am a town meeting member, and I have been listening to all this, and I've been getting several phone calls about some of the the mandates and things, and so I'm just going to talk at a super high level. I'm not going to get down into the weeds here, but let's just think about this for a minute. I've heard some of the Danvers residents talk about this at the school committee meetings and here else, and they all have the same theme, and whether they mix it in with other personal things and things like that, the facts are the facts. We're told to follow the science. So I really want to start looking at the science. You can't just dismiss things because they're not fitting into the mold. Okay, so I want to just like again, the masks and the mandates. When you look at it at the high level, is we used to have second opinions, peer reviews, and all sorts of things that are not allowed anymore because we're getting canceled and deleted off off the social media and things. The information is banned basically. But when you look at what's happening in this country, we want to follow the science. Real science is observable, repeatable. That's science. You can see it, measure it, and count it. So, but the science that we're following break down into red states and blue states. The blue states are still forcing mandates on all levels. The red states have gone away from the mandates, and it's you have to look at the facts of what's going on in the statistics. Red states, blue states, what's happening, and again, the facts will bear out that these high instances, the 400,000 rates, which people said the CDC has admitted that the tests false positives and they'll come up positive whether you have the flu or any miscellaneous virus. So again, I just want people to be aware of that, and I just want to know to know that people have put in affidavits and all sorts of things about these things, and I just want to make sure that we're looking at both sides of the issue without dismissing people for comments. I just had an issue with that, and I guess I'm done. But I did have one question. When we talked about the when I forget the woman's name, she talked about all the statistics. She talked about the majority of the cases that are in the hospitals were people who were unvaccinated, but there was no number. So in other words, there's 494 people in Danvers that tested positive for COVID, if that's the real number. And then we say that the large majority of people in the hospital of those 490 are unvaccinated, but she didn't say what number, and where are these statistics actually coming from?
Well, nationwide, 97% of the hospitalizations are in unvaccinated people.
Board members, it looks like we had one more person raise their hand. This is Erica. I don't have a last name. Erica, I'm going to allow your mic, and then you'll have to unmute yourself. And if you can state your name for the record. And your 3 minutes starts now.
Hi, Aaron. It's Erica Horenstein.
Oh, hello.
How are you? I'm wearing a headset. I'm hoping to drown out my kids who are watching the Bruins. So I just, at first, I just want to say, because it has to be said, with all due respect, we can't tolerate a pediatrician determining that no child, blanket statement, is impacted by wearing masks. That's really irresponsible. Children are not robots. Some of them are impacted. We cannot pretend that each one of them handles any of this exactly the same way. So please don't generalize. It's really just unfair to the kids. And it's unfair to parents who do know their children best. I also just wanted to take a minute because I had emailed back in November the board asking specifically for numbers regarding the matter of breakthrough cases. And I emailed again a day specifically, and I'm going to read that email because I never got a response. And I think especially right now, given that our numbers are highest when vaccinations are highest, I think this is a number that really should be reported. So in my email I wrote, I would appreciate if you would address at tonight's school committee meeting that at the September 13th meeting, you are quoted as saying that tracking breakthrough cases became too difficult because, quote, it's going to take hours and hours because we have to go into each patient and go through their medical records. And I added, isn't it true, in fact, that using the Maven system you are able to report within minutes the vaccination status as well as any previous COVID infection information of a currently positive case. As I understand it, this report is standard procedure and readily available. If you are unaware of this report, I suggest that you contact your fellow DPH administrators to find the means to track and report on this information. The community you serve has been publicly requesting this since August. Community members, parents, school committee members, and all constituents of the Danvers community deserve to have all of the information at hand to make decisions accordingly, not just cherry-picked information that fits one narrative, and I look forward to your response. Again, I think I sent this in November, and here we are in January. We are saying we're at numbers at our highest. I find it concerning that there are rules for vaccinated and rules for unvaccinated, and we're seeing a lot of vaccinated cases, and I think that that number needs to start taking a priority. I'm very concerned. I'm concerned that, you know, if you're a vaccinated person, I personally know a number of vaccinated individuals currently positive with COVID, and they have highly more rights than those who are unvaccinated. And I think it's important to be told all of the information. And again, I've asked this directly of the source. I'm not going to, you know, quote YouTube or whatever that we're accused of, you know, following. I'm asking all of you, and I never got a response, so I'm asking publicly. Thank you.
You know that you still have Mr. Morose on the screen. I don't know if he's. Aaron?
Yep, no, he's muted. It's just what you see on your screen is different from what everyone else.
Oh, okay. All right. No, I didn't know. I mean, I was trying not to invade his personal life. I mean, you know, you may want to get up and scratch himself or something.
I think on that last comment, I'll just say, Erica, I'm not sure when a day left and all of that, but if you want to pass me along again that request, we can do what we can. I think, as I was just talking to Judith, I think unfortunately we don't produce a lot of data. What we're using is through the Maven, the state's website. They're not really making that easy for us to access through that system. And you're not alone in asking for that, meaning we have other communities that want that data. And at this point, one of our frustrations has been some of those reports for what would seem to be readily knowable information is just not being reported in that system in an easily digestible manner. We would literally have to go through each individual case to determine whether or not they have received their shots, cross-reference that in another database against whether or not they're currently COVID positive and when those dates matched up. Obviously, given that we've had thousands of cases, that's a lot of manpower. Judith is already working 65 hours a week, just trying to manage this.
Totally. I've been told by neighboring towns, a direct neighbor, Department of Public Health nurse, that it is an immediate report and she gets it readily available. That's why I was throwing that out there to him. It was concerning to me
Throw
to
the
hear
name. Throw the name. We'd be happy if there's an easier way to do it. We'd love.
Yeah, I mean, I guess I'm asking, and just like I asked him, reach out to another DPH because they're saying it's readily available to them, and I, as you were saying, I would prefer it be readily available for us as well.
I also want, if I could address one more thing too, because I'm sorry if there's a misconception. I didn't mean to imply that children are not affected by masks. I know they are. What I was saying is that I think that children more readily accept it than we give them credit for. And I know there are children with special needs who have great difficulty, and I'm very sensitive to that. But most children can wear a mask comfortably without too much trouble. And I really honestly don't think it affects their mental health directly in most cases. I guess.
Thank you.
Okay.
That is everybody. Dr. McLaughlin.
Yep. Okay.
In theory, I think that completes your agenda unless you have other items. Again, as we talked about the last time, Judith is now including you all in our weekly internal communications on the numbers. And so we'll continue to give you updates weekly on current cases and go from there.
And Mr. Chairman, before we get to the next item, I just wanted to make another quick comment, if I may.
Sure.
To all the residents, and maybe you were gonna say that, I just want to thank you all for participating, for joining us today. It's important to hear from you all. I can tell you for my part, I hear you. I sympathize with you. This has been tough for all of us. We're all into this together. Unfortunately, we're in a situation where when we look at the public health, there's a fine line between, personal liberty or choices and public health. And we have no choice but to do the three pillars of public health, which is prevent, protect, and promote. And the decision that we made on the 23rd, for example, and that we've been making throughout this pandemic, that's the sole purpose. The mask mandate will be rescinded as soon as it is possible. This is not something that's going to stay forever. And someone mentioned about exemption. There are some exceptions there. I don't think we're expecting a 1-year-old to wear a mask. So we want to really stay. There's a difference between what's really accurate and the way it is portrayed. There are some exemptions in that mandate. And as soon as we will be reviewing this constantly to make sure that it is rescinded as soon as possible. But this decision was made solely for the public health good. There's no other motive than that. And I want you all to hear that. You may believe or not believe it, but I can attest to that all of us are making these decisions, very difficult decisions that are affecting a lot of people, a lot of businesses, like someone said earlier. There are also some businesses that were asking for this a long time ago. But at the time, the cases were not as high as now. So I just ask for your patience and your indulgence, and know that we care and we will get through this together. And I also hope that we spend a little more time talking about the danger of getting COVID than the risk of wearing the mask. I don't think we spend a lot of time speaking to the people about how bad this virus is and the danger of contracting the disease itself. We spend a lot of time, a lot of comments were about the mask, but we want to also consider the fact that catching this virus is terrible, and there's some really long-term effects, lung damage, cardiac issues that none of us ever know yet. So bear with us, we will get through this together. Thank you, Mr. Chairman.
Thank you, Dee. That was very eloquent, and I'm almost ashamed of myself that I didn't say that first, but thank you for bringing that out, because that is very, very important.
Extremely. I agree 100% with that. It was very well said, Dee,
Yes.
and I would echo everything that you just said.
Now, one other question before I say anything else and put my foot back in my mouth. On the lower left screen, there's still the E, which was the Erica. Is she still on this call? The 4 screens.
Yes, Erica's still on the call. Again, I think Microsoft will kind of give you a different Brady Bunch than what everyone else is
What
getting.
I'm saying is if I say something now, is she going to hear it? I mean,
Yep. Well, if she's here and she's.
Oh, she's here. Okay, that's what I didn't know. No, that's what I was just asking. Okay.
Yep.
All right. So what do we have next?
Now, adjournment.
Well, can I just ask for a very quick, brief summary of what's going on with our lumbering operations on 114? I mean, without.
Oh, sure. Absolutely. So at a high level, a day before he left, commissioned a comprehensive review of, I can't remember the specific address, but basically the thrift shop operation where there's a lot of tree felling and tree processing right in front of the Rose Court condominiums.
Right.
He contracted with Wesson and Sampson Engineering to kind of do a tip to tail code review. So this included zoning, health, nuisance, fire, building, a whole slew of code review based on the number of and persistent complaints we've had at that location regarding the lumber activities that the Great Rock Church is engaging in there. We did get a preliminary report from them, or their first submittal back to us. We did find a number of violations. Many of them are zoning. Most of them are fire code problems. And we are meeting with them on Monday to sit down and try to figure out a pathway forward. Because they're a religious institution, they are afforded certain protections from the town's zoning bylaws. For better or for worse, most of the flaws at the site have nothing to do with zoning and have to do with life safety issues regulated by other codes. So we are likely pursuing some sort of remediation on that front with them that could culminate in something akin to site plan approval, where basically they're going to need to document to us that they can address the fire and building code issues that we have observed in a manner that respects the Conservation Commission jurisdiction that they are right up against. There's a wetland right next door, while also respecting what the neighbors next door need for livability. We'll see where that goes. Hopefully, everybody will get along and work towards a solution that respects their rights under the law and respects our rights to enforce certain code provisions. So should have more for you on that front after Monday. That hopefully will be a good meeting and a productive meeting, but I can report back to you early next week on how that went.
You know, from what you said, doesn't sound like a lot of Board of Health involvement in this anymore.
At this point, there wasn't any identified strictly code problems. I think we've dealt with noise a lot there, and that obviously is still kind of hanging out there. There was one issue related to the potential presence of bugs, and that could be an infestation on their site that is contributing to something in the condominiums. We're still trying to figure that out. This review did not identify that as a potential problem, but that's still an open item that the residents are complaining about.
All right, so I guess we should adjourn. Anybody want to make a motion?
So move.
Second.
All in favor, D?
Aye.
Sheila?
Aye.
I say aye too. Okay, we're adjourned.
Good night, everybody.
Night,
Thank you very much.
Thank you.
Bye.